மேனேஜருக்கு தெரியுமா ஃபர்ஸ்ட் இந்த இஷ்யூ?
Yeah, my phone. Yeah. Stand and get it. How do you usually do it? You guys don't have laptop now. How do you do it?
Hey, I have my desktop. I do
No
it.
problem.
Yes.
No, I'll send it to you.
Oh, you have to correct some number. Vijay Singh, Canara Bank Manager. Next.
நான் ஜூம் லான்ச் ஆகலன்னு வெயிட் பண்ண
அனுப்பிச்சிட்டேன் உங்களுக்கு மெசேஜ்
வாட்ஸ்அப்லயா? ஐயோ எந்த ஃபோன் கம்பெனி 9500 பர்சனல் ஃபோன் போய் நான் open சொல்லு நம்பர் சொல்லு.
சரி, போட்டு கொடுங்க. ஃபர்ஸ்ட் நான் பேசுறேன், அப்புறம் சொல்றேன். 97393 1196.
Send me a mail.
No, I haven't sent you a mail.
Send it to 950001. That's my
I don't have any other number, yeah.
Panagi's number.
Sending his number.
Yes, get that done.
Okay. Yeah, people have started coming in.
What do we do? Put your phone on. What do I do? You're not going to be inside.
I should be inside.
Shit,
Where are you going?
He said, I want to sit there and write. It's very difficult writing.
He's going to open a meeting, say bye bye and go off.
So that, why should I be there? You be there.
But he told you to come inside.
Okay.
Hello, wait, don't leave this with me and go. சரி காலை நாள் சுரேஷ்
வந்துட்டேன்.
நம்ம நேற்றே ட்ரை பண்ணிருக்கோம். மீட்டிங் ஐடி
Eating ID. See there, no. 839 208 4959.
084959.
I don't know, wait. 49549. 549. I did.
What is all this? Hello? I'll try. Somebody went inside without giving me the number. 100 Vijay. Why is this not switching the number?
Which one, yes? Okay.
It's okay.
Now you closed it.
I didn't do anything. Yeah.
You're here. What is the number?
95001295.
No, this is the Xiaomi.
Ah, that one only, that one only, that one
This is
only.
a Poco.
No, but anyway, it came Xiaomi only here. A Poco, what the hell? Post is join, let them know you're here.
Okay. No problem.
Yeah, but you need to see his face, right?
Wait, let me admit.
No, I'll
Probably.
come back from the first again.
I will admit everyone.
Where are you going?
Mm.
And then
You have an issue about this. It started.
you started, that's all. If the Wi-Fi is so this thing here, what can I do? Leave meeting, I left the meeting.
You don't leave.
Stupid girl. Join the meeting. It's not coming. His ID is not coming.
No worries. You say
Go,
something.
go.
Maybe I go to
You
him.
hold on and block. 839. Delay.
Okay. Meeting join ಮಾತ್ರ பண்ணிருக்கீங்களா sir? Sir, நீங்கள் Rekha ma'am has also joined, sir. நீங்க வரலையா sir? Okay. Because
He's not picking up the line. Me and Suresh both are trying. He's not picking up the line.
yes, yes. I can see you. Good afternoon, everyone. We are waiting for Paul sir to join the meeting and Bhavani ma'am to join the meeting.
Morning, Paul.
Hey, Rekha, how are you?
Happy birthday.
Good. Let me get some extra light on my face here. Ta-da! Well, that's too bright. Turn it down. I'll be blind.
No,
There we go.
we want to wish you a happy birthday. So everyone, it was Paul's birthday a few days ago.
Hello, Paul. Good morning. Happy
Hey.
birthday to you.
Thank you very much. Thank you. I was on the actual day. I was in a prison teaching some prisoners how to read and write. So they sang me happy birthday and made me a cup of coffee and gave me a pack of biscuits. And I have no idea where they got the biscuits from, but I wasn't going to ask any questions.
That's the best way to celebrate your birthday.
Absolutely, absolutely. How is everyone?
All well.
Good. I love Japan's Mount Fuji behind. I wish
Yes.
was there.
Yes.
When I went to Japan, I went to the lake nearby, and I picked probably the very worst day. It was very cloudy, and you could barely see 100 meters in front. So I never got to see Mount Fuji. So that's my excuse to need to go back, and I'm going to climb it next time.
Yeah, please come in. It's a very cold season. It's winter in Japan, so it's very much of snow.
That's where you need the sake to warm you up. Hey Lolita, how are you?
Fine, thank you.
Hi,
Good,
everyone.
Yeah.
Hi. Hi, this is Madiha from UAE. Hi, Mr. Harushi. How are you? We met
Hi,
before.
how are you?
Yes,
I'm good. How are you?
yes. I remember. Remember.
You
I
remember
yeah.
we met in
Yes,
Australia?
I
Yeah,
remember. Yeah.
yeah.
So we have Dr. Priya online from India.
Hello. Hello, everybody. Hi.
Hello Priya, how are you?
I am well, thank you. How are you?
Hi, Priya.
Hi. Hi. Hi, Lalita.
Rekha, you're smiling. It's so nice to see you smiling all the time.
I always smile.
You give energy to everybody.
When I see you guys, I feel like smiling. I mean, it's a happy moment, and that too, it was Paul's birthday 2 days ago, so we are still celebrating.
And Vietnam, how are you?
Hello, nice to see you all. I'm all well. So glad to see
Good.
you all
How's
today.
how's your family?
Very fine, thanks. And we already have a pilot group of parents, and we are doing some organization here already. So I'm seeking for your your consult next time.
And
Bhavani ma'am
we're
has joined, I think, sir.
Mongolia.
Hello.
I believe that
She's coming.
you had a birthday 2 days ago.
Yes, I had my birthday 2 days ago. Now I'm on my way to Bangalore ashram.
Fantastic. Well, belated happy birthday to you.
Thank you.
So, Paul, Bhavani has joined.
Hi. Sorry. I was just on my way. How are you all? Congratulations, Rekha.
Thank you, Bhavani.
Great job. Yeah, so Britta, thank you very much for the meeting, the minutes of the meeting. I think, is everybody there or anybody to join in? Okay, we start.
I think we can start because we're kind of 5 minutes into the time schedule.
Okay.
Before you start, Dr. Bhavani, what I'd like to do is just say two things very quickly.
Sure.
Firstly, officially, just to minute it, congratulations to Rekha on the humanitarian award. Very much deserved, and that's what happens when you put in about 4 decades of work. You finally get something people pat you on the back officially, and that's long overdue. So well done on that. And the other thing is something exciting. More details to follow, but provisionally at this point, we're looking at January next year for the very first Asia Pacific Down Syndrome Federation Games. And this is going to be fantastic. Sports and every country within our region is invited. More details to follow, but I'm just telling you now, it's going to be brilliant, and it's going to be competitive. So we need to get ready for all that competitiveness that's going to come from everybody. Okay, so there we go. I'm going to pass you over now to the master, Bhavani.
Hi. Welcome all of you, and thank you for taking time off to actually participate in the meeting. I think Britta has circulated the minutes, so would be great if you all have a look at the minutes, and then we can kind of proceed if there is nothing else to kind of share in the minutes that is urgent. But maybe I know we've actually had a clear agenda, but if I can get your country representatives to just like tell me if there's anything that you have done between the last time and this meeting that is related to health, that'll be great. Or if you can even think about it so that you can share at the end, so that it'll be just nice to know that people have made a bit of progress within their own capacity. Because I know Nepal has actually mentioned about commencing a multidisciplinary clinic, or the preliminary work that's being done to start a multidisciplinary clinic. And so congratulations, Lalita, for that. I think it's great. So if each one of you has something that has even moved like a fraction in health within your own country, it'll be great to just hear that, so that at least we can see where you're all kind of, where exactly your needs are. So that I think that'll be great. But maybe to start with, I'm just going to really focus only on one big agenda so that we get enough ideas, and that's on the postnatal diagnosis and how we break the news. I think that was what we actually spoke about last time, and we hope that we'll have at least the first draft of the guidelines before we have the next meet. I really would like appreciate some involvement from all countries, and one or two representatives who can actually work with me, because it'll be impossible for me to work through and give you some set of guidelines which may not be relevant to each one of your countries or region. And the reason I'm saying this is, if you had the time to actually read through that article I sent you, which is Consensus on Postnatal Guidelines, and I think there are a couple of them, the focus is always on a prime care physician trying to actually break the news. Somebody who has a knowledge on Down syndrome and what are the community support structures available, and kind of understanding a little bit on the lifespan of a person with Down syndrome. And I'm really not sure within each one of your country where the children are really born and who actually will break the news first. I don't have any idea on that. I know in Singapore what happens, and I'm sure kind of very similar in India as well. But I'm really not sure about the other countries as to where are the kids born and where does the diagnosis get confirmed and who actually talks to them. Because if we don't know that, then the guidelines will be of no value. We need to actually be able to train those people to be able to bring that news. So that's very relevant for me, and I think it's very important that I get participation from your own country to nominate somebody or at least write to me these details, so that at least we can start working on some kind of plan and videos. I mean, it's quite a long and tedious process. So that's very important for me. Maybe I can hear from each one of you here at this point in time about those three first questions. Where are majority of the children born? If you have any idea. And two, who would generally break the news? Would it be like the nurse? Would it be like the healthcare attendant? Would it be a professional? Would it be their own GP, their family practitioner? I have really no idea what happens, who breaks the news. So I think countries who are here, if you could just give me this information to start with, it'll be great.
Priya, would you like to tell Bhavani who breaks the news and where children are born? Priya?
Sorry, I couldn't hear you.
No,
I'm
it's
actually
yeah.
traveling. So Wi-Fi is a bit poor. Sorry, what did you say?
Bhavani.
No, just wanted to know where the children are generally kind of born. I'm presuming, I don't expect you to know exactly, but who would be the first person who actually provides this diagnosis to the family? Who would be the first person who breaks the news? Because our understanding is that the first news that is broken to them, if it is actually said in a not a nice manner, is something that actually influences the bonding of the family and the long term for the family. So we are trying to understand who is it that actually tells the family that your child is now, we are suspecting the child has got features of Down syndrome.
So here in India, we have the private and the public setup.
Yeah.
But either way, in whichever setup the baby is born, there definitely is a pediatrician. If it's a cesarean, they're there at the time of delivery. or if it's a normal delivery, they do come in later. They do a complete examination of the baby. So at that time, pediatrician mostly they are well informed, because in most healthcare is fairly robust in India. So other than the really rural areas, most of them are able to at least visually, come to a diagnosis at that time. And definitely they have a discussion with the obstetrician. And then I think together they call the parents and do inform them. So it's usually the pediatrician and the obstetrician who are part of the group who inform. I don't think it's a one-person show.
Okay.
Probably, repeated talks, and then they do send a sample for karyotyping before they confirm and then take it to the parents. That's the
Okay.
system in place here.
Is it possible at all to get like a sample survey from, because I think you do so many camps and stuff. Would it be possible at all to talk to like 10 families from, or even 5 families, just to understand, what was actually said? Is that a possibility at all that can
No,
happen?
absolutely. Yeah. I think it's a definite possibility.
Right.
It can
Just
happen.
so Dr. Madiha from the United Arab Emirates has her hand
Yeah.
up.
Yeah.
Yeah, thank you. So I have two different experience. In one center, there was a genetist. So if there is an antenatal diagnosis, usually the genetist is the one is going to break the news and speak to the mother. If it is antenatal. If it is postnatal, on that center also, because the genetist is well trained on counseling them. So also during the newborn period, the genetist will just go to visit the family and explain everything in the proper way. In another center, currently, as Bria said, if it is a private sector or even the governmental sector, the one who break news is the attendant healthcare provider, and this is basically is the neonatologist. And I cannot say what they exactly say, but usually when the patient reach my clinic, and usually they reach my clinic after I'm a general pediatrician. So when they reach my clinic, that is specific clinic for Down syndrome, I speak to them, then I want to listen what they have understood from that counseling. Probably sometimes the family always will be on that shock time, so whatsoever had been said is not accepted by them most of the time. Anyway, to deliver the information is the healthcare provider, the neonatologist on that setting, who is attending the delivery.
Great. So great. And can I just ask you at the same time, when you meant that the geneticist who's actually trained in counseling, is there any formal counseling program in UAE that actually trains people to provide the diagnosis? Is that something that they go through a formal accreditation course?
For the Down syndrome specifically, no, but for any chromosomal abnormalities, now there is counselors. Yes, we do have counselors for that.
Okay, and they are like basically trained people who actually, they have a program.
Yes, they are trained either internally or externally, but they are not available in all facilities.
Yes, understand. Okay, great.
I would
So
be
you
interested
have
to know, carrying on from Dr. Bhavani, in terms of the counselling there, does every country have counsellors available?
We also have geneticists whom we refer to, but they are not the first people who break the news. They are, of course, part of the spectrum. It's a teamwork. So they would also be involved, but not immediately, but definitely at a later point. And here we also have the Down Syndrome Federation where they are referred to as well.
Yeah.
So the system is slightly different here.
Yeah.
My request to you, Bhavani, is what exactly do you want us to ask these parents?
I will send you a set of questions because I think we actually did that in Singapore. I don't know if Singapore has joined. I don't know if Linda has joined, but I mean, I did ask her to kind of at least take a sample survey of
They
about
have
10 or
joined,
12.
ma'am. I think Evelyn ma'am has joined. She has,
Evelyn
I
is there.
think.
I don't know if Evelyn wants to just chip in, but I can't.
Rima has her hand up.
Okay.
Hi, ma'am. I would like to speak from Nepal, ma'am.
Yeah.
Yeah, in Nepal, like if it's in the city areas, mostly the gynecologists will tell the parents during the antenatal checkup. And if it's after the birth, either the gynecologist or the neonatologist or the pediatrician will be there. But
Okay.
rural areas where big hospitals are not available in Nepal, the physician or the health post in charge or sometimes the nurses will tell about the diagnosis, and confirmation they send to the Kathmandu, the city area, for the confirmation.
Yeah. Great. I think that's the spread I wanted to hear, you know, because I don't think it is uniform. If you're a city, I think exactly it will be the gynecologist, the obstetrician, it can be the pediatrician, the neonatologist, depending on that spectrum. But I suppose in rural, it'll always be the healthcare assistants or, you know, that's the group of people who will convey the message.
Yes.
Great. Any other country wants to chip in to say what happens? It's just a good start.
Evelyn here.
Hey, hi, Evelyn.
Yeah, hi. Okay, I'm from Singapore, same as Dr. Bhavani. So I'm sure Dr. Bhavani knows, how it is in the hospital. So maybe sharing for the other participants information. So in Singapore, actually, antenatal screening is common almost for the entire population. So I would say most of them are screened antenatally and they know of the risk. And it will be very much the gynecologist and the medical team who breaks the news to the parents. But I think on top of this, then just to add on to the part about the counseling, so in most restructured and even private hospital, that's where most of the children are being born. They do have counselors and social workers who are involved. But through, we are from the Down Syndrome Association, and through what we have sensed is parents, they appreciate a lot of medical information from the medical practitioners, but there's always this psychosocial part which is not being attended to, and they are less inclined to want to talk to the counselors or social workers in the hospital because, they see that as a medical thing. But we also sense that a lot of parents then go onto the internet and search for information, and then quite a number of them will approach us to seek support. They always coming with very technical question. We want to know how is it like how to take care of the children. But after one conversation, usually then they reveal a lot of their emotional struggles. So a lot of grief and loss issues, and of course, if we know about grief work, then at the point of screening, usually there's a lot of shock and disbelief and they feel very lost. So I think this is where it's very important for practitioners to be trained, because on top of just information dissemination, they need to provide the emotional support. Yeah,
Absolutely.
and also holding that space for them to say whatever they want to say. So in Singapore, I think a lot of them, if we screen antenatally, some of them will still choose to keep the baby. A lot of it is because of religious reasons. Okay, so we have some religions here that do not allow for abortion. So, on top of the shock, I think there's also this part about then, the choice is taken away from them in that sense. So sometimes it's also hard for them to talk to their family members who may share a different belief from them. Yeah, so I think that's when I thought the counseling component is very important in psychosocial. And so last year, we had quite a number of parents who came in upon screening positive or when the child was born. We also find that, this counseling is very effective if we can build it before the birth. So upon screening, if we can build that relationship with them, they are more likely to want to continue talking to us. But we also sense that there's a dip in them reaching out once the baby is born. I guess for very practical reasons, like they have to look after the children. But at the same time, I think that's also the part where they start to struggle a lot. And we find that some parents, they even form a resistance against the child. Yeah. So we also see while they are less likely to reach out to us after the birth of the baby, we thought this is the period where even more counseling support needs to be offered to them.
Right. Thanks, Evelyn. I think so. Yeah, the Singapore setup is exactly what Evelyn said. Mostly pediatrician, neonatologist, mostly neonatologists, and most of them in hospital settings will definitely be referred to the Down Syndrome Association for psychosocial support. Any other countries?
Yeah, I'm
I
from
think
Sri
Sri
Lanka.
Lanka was. Yeah. Hi, welcome.
Hi. Thanks. Thing is, our setup also very closer to the India. Majority of our birth occurs in centers where the obstetricians or pediatricians are available. But thing is, the rest is lacking in the karyotyping and genetic services are available in the few cities. It's not widely available. Other things about the counseling, even genetics or the counseling by the pediatricians, I think the understanding and the knowledge and their experience of delivering this message, I think it's not widely, spread, and it's not universal understanding. I think about the way of delivering and the genetic counseling part is, I think, lacking. So I think it's very limited to the only few centers. So that part is lacking in comparison to the most of these other places. Otherwise, it's more closer to the India. That's what our setup is.
Yeah, great.
Okay.
Any other country would like to chip in to say what? No, Vietnam? Is there?
So, because we don't really have the survey to have a correct number. But from what I know, from the news that I read in our group, the majority of the child was born in the hospital, just like other ones. And the one who pronounce news to the family, usually the doctors who see that they have like abnormal in the child, because usually when a baby in the womb have diagnostic with Down syndrome, most of them will abort the baby. And yes, and the one who was born, there very little of them was decided to keep up the family, but most of them are unexpected. They usually have a screen test as usual, but they didn't show any abnormal. And then the doctors see that the baby have abnormal, and they inform to the family to have more tests.
Yeah. So again, doctors, right? Majority from your knowledge, yes.
Yes.
Right. So that I think that from the distribution, as I can understand, will be if they are born in cities where there are the hospitals, be it public or private, it will be the doctors. If they are urban and they are born in rural areas, I presume the first point of call will be a healthcare assistant, or if there is a pediatrician there, then it will be the pediatrician who will actually convey the news. Okay, so I think at least that gives us a better idea of whom you can actually channel whatever you're trying to do. Because if you're trying to actually formulate guidelines, videos, it has to actually reach the target population who is basically going to do the majority of the counseling. And so it's very important that I think each country understands whom you're going to actually distribute this information to, or where is this distribution going to happen in such a way that everybody gets to have some idea of what is right. And two is, are there regulations in each one of your country? Like, for example, if I had to do something in an individual hospital, I'll have to still go through the head of my department to actually say, look, I'm going to put this program in place, and these are the aims, and this is the method I'm going to use. So each country, I don't know. Let's say you do bring in like a set of videos or some kind of guidelines. Can you just implement it on the floor without any regulatory body saying, I need to actually see what you're actually saying. I don't know if I'm getting this right, but is there a regulatory body you need to go through before this is actually considered as okay for you to disseminate? That's the next part I wanted to go through.
Can I speak?
Yes, please.
Yeah. So here, definitely, if we are going to, have a set of guidelines, it would have to go through regulatory bodies like the Indian Academy of Pediatrics,
Yeah.
probably the FOXY or the obstetric body as well.
Yeah. Yeah.
So that would have a better reach, and it
Yeah.
would be uniform across the country,
Yeah.
both
Agreed.
private and public.
Agreed.
Cover both.
Agreed. I think
Be easier to implement as well because we have very strong bodies in place.
Yeah. Yeah. I mean, I do think it's relevant to actually have regulatory bodies look through the guidelines from your own country, and they may want to add, delete, whatever that is relevant to each of your countries, right? Because
yeah.
So I think, is that something that APDSF agrees, or or does it go through individual Down syndrome associations? I think those are two important things that you need to decide within your own.
Now, I think if we are going to come up with standard guidelines, it should be from the APDSF because I think Europe has different guidelines, and probably US. But as a Asia Pacific body, I think it's very important that the guidelines come from this body, and then it could be sent to the other regulatory bodies in each country, whatever is there.
I mean,
Is it something
I agree.
Yeah,
Just to say, I agree. It's kind of like setting a platinum standard, and we're very aware that every country's facilities, cultures, economic differences are always going to be a different sort of end of the spectrum. But I think if we can create like a platinum standard for everyone to follow a tour or to present to the people around them, I think that would be great.
Yeah. I mean, the reason I'm bringing this up is even in Singapore, where we have everything pretty much streamlined. When I used to do the antenatal counseling, and I insisted that they should be referred to the Down Syndrome Association for people to actually understand or meet families that have actually journeyed through a person. There was a lot of resistance from the obstetricians and saying that they had their own guidelines from the obstetric society to say what is need to be said, and they were like, Down Syndrome Association referral was not really a part of that guideline, right? So it's important to start that when you actually are going to bring these things, that regulatory bodies also agree, because people are always worried that when you're referring to a parent body, that there's going to be an influence on the family that is kind of something different. So they are always like wary about these things, because most of the obstetricians or people, though it is supposed to be non-directive counseling, is kind of a bit of directive counseling from what I've seen. It's not, I wouldn't say in my own personal experience, having sat through many of the sessions, that they are considered non-directive, because ultimately the parent trusts the obstetrician and they will say, what would you do? Or something, they would ask a question that is like very personal, or they would ask about, is it easy in Singapore to have a child with special needs? There would be some question that will be phrased. And if the obstetrician, even though they are pretty literate and they have guidelines, they will sway towards saying, it's not that easy, it's like a challenge. And so I think it's very important that we form the guidelines, but you also within your own country have to form a very clear path of how this news is going to be disseminated and neutral and accepted.
I think just as we have guidelines for, say, treating diseases like say
Yeah.
malaria or
Yeah.
in various infectious diseases, this definitely should be in place.
Yeah.
And a lot of dialogue can be had with these bodies I'm sure it would give them also a lot of comfort to have a set of guidelines in place. So instead of somebody individually deciding what they would talk to the parent.
Yeah.
So everything need not be right in the dialogue.
Yeah, agree. So if each country actually disseminates this information from their own association into the regulatory bodies, is that something practical for every country? I know India, you can have conversations with IAP and the obstetric group, and you can kind of start the dialogue. But is it practical for all the countries through the association? Because now it is going through APDSF and DSA of that country. Is it practical for each country to be able to do that?
Bhavani, a bit of more explanation. I didn't get it well, what you're saying.
Okay. So let us say we bring these postnatal guidelines, Lalita. Let's say there's a standard way of doing something that we have researched, and we say that this would be a good way. These are the things you need to discuss. These are the optimal things that would be good in kind of a non-threatening tone, or you introduce some video clips or some simulations. Now, you can use it within Down Syndrome Association in Nepal, right? I mean, you can use it within yourself. But let us say you want to now disseminate this information to other doctors who are in different hospitals and settings where obviously that's where the babies are born, right? So will then your regulatory body, be it the Academy of Pediatrics in Nepal or Academy of Medicine, I don't know where it falls under, will they then say you can't do things like this without going through us? Because you're now distributing to more people than within your own organization. Will they say, no, this has to be vetted by our genetics expert or expert committee on, I don't know who the expert committee is, but will they then say that you have to channel this through us before you send it out to the doctors?
Yeah,
I mean,
this thing would come up in our country.
yes. I think it
The
would come
Ministry
up in
of
most
Health
countries.
and all those things.
Yeah,
We have to go to them and
because I mean, one is using it within your own framework, but you're already kind of a bit of an expert in that field. We are now talking that this needs to go to lay persons because they are the ones who are actually breaking the news. So we are now saying, can I just send this set of information to some hospital and say, please use this? And if it now goes to Ministry of Health that this is being done, will there be then a question to say, this has had to go through our own regulatory body, and we are the ones who will tell you whether this is appropriate thing or not?
yeah, that would be a thing to decide and then do according to the country.
Yes.
Yeah.
Yes. Yeah, I just wanted all of you to start thinking through these things because these things take a lot of time. Right? I mean, each country will want to modify something that is done by another group of people because you have your own infrastructure, and so they will definitely want to kind of tweak it to the needs of your own country. So I think start thinking through who are your regulatory bodies, how do we actually get access to these people, and what kind of material will they accept? Because I don't know, do they want like graded evidence for each one of the, like, for example, if I say it has to be done in a secluded room along with the obstetrician, the both parents and the child being there, and you have to address the child with the name. I'm just giving you an example. If I say things like that, well, actually, is that some, and they say, where is the evidence for you to say all this? Who's telling you that this is the right way? So do they want graded evidence for everything, or they are acceptable that this is a norm? And so that's why I brought this question of survey, because at least you can go by, if there is no graded evidence and there's nothing in literature, then we say, okay, the best thing we have is a survey from each one of your countries, and this is the conclusion we got, something like that.
So, Dr. Mahiha from UAE has asked if there's a sample of survey questions.
I'm
are we intending
just
to
kind of
create a template?
formulating. Yeah, I'm just formulating the questions. I'm going to actually send it out, but then please feel free to add on the questions. This is my perspective, but it may not be the perspective in every country. So tweak the questions according to your needs, and then let's collectively look at the questions and then say, okay, this is probably the neutralist of all for that it goes into all countries. So I will send out a sample questionnaire, but I'll make it like pretty short. I don't think we need to have like too much of detail. Remember, I don't know how many of you are like involved in research and statistics. These are considered as qualitative questions because you basically are just getting a narration from families. It's not like you're going to do a statistical analysis on them, but you're just getting information from families, and you kind of tweak from that and say, okay, the families are saying the best place to do it is in a quiet room and not when there is inside the labor ward where things are happening. I'd like it to be in a quiet room. I'd like my family to be present. I'd like my child to be with me when I'm talking. I mean, that these are the kind of things that I'm trying to bring. They're quite simple to do, but relevant for families. So I'll send out the sample question. I think we're just doing, I'll probably work with the Singapore DSA because I think that's something they do on a regular basis. They actually talk to families. So I will work with them and then send out the questionnaires from Singapore. So I think that's a start. So you can see there's a fair amount of work, but I think let's just chip at it slowly so that at least we kind of have something that looks like a plan at the end. Meanwhile, I'd like each one of your countries to please send things that you think are relevant that should go into the postnatal counseling. It's really important for me to know where each one of you actually come from. It's very easy for me to write 20 things, but that is not the right way when we're doing it collectively as an organization. Each country say that, this is an aspect that I want to be included, or this is an aspect that I want it to be kind of researched through, because then I can at least kind of tell each one of you, can you kind of do a bit of work on this? Otherwise, it's not going to actually be a fruitful one. It'll just lie in some corner of the room and not be used.
So Bhavani, if you send us your questions, I mean, what you're formulating, then we'll add on to it, because I think every country has a different way of dealing. Because normally, actually, I always feel it is family specific.
Yeah.
In India, it is not like you can just, talk high-level conversations with families who don't understand all of this, because if you say genetics, many people, but today I can tell you one thing, in the last 5 years, there's been a huge awareness in India, huge awareness. And like Priya says, now people are more aware, they are more questioning. And honestly, we've had some amazing camps in the Naxal areas. Dibrugarh, you won't believe it, they had a complete setup. They didn't want anybody from the south. They said, we don't want your doctors. We have a complete team, because one important thing I have to tell you is the language.
Yeah.
So language makes all the difference for us, because if you don't speak their language, they don't get close to you.
Yeah.
These are the things. And now we're going, I would like these questions because I'm now going to Meghalaya. And these are the areas where we are now entering without, and identification of a person with Down syndrome at birth is quite difficult in some of our regions.
Yes.
Because if you look at even Nepal, or you look at areas like that, like Bhutan or, Sikkim, we find it very difficult because we, sometimes I make a mistake myself and say, oh, this child, but you have to understand that karyotyping is so important there.
Yeah.
So and that's done quite well in India. That's being done all over. And I think Priya, add on, I think we have really worked hard on this.
Yeah.
Yeah, I think what you say is true. After Bhavani sends the initial thing, we'll add on more questions so we can all formulate it together. And it also has to be broken down later into regional languages. That, of course,
Yeah.
goes without saying because it is a big barrier.
Yeah.
But to at least formulate initial guidelines, it would make a huge difference to the pediatrician and to the obstetrician as well because they also find it extremely difficult.
Yeah. Yeah.
Then, of course, then the benefit goes to the child and the parent.
Yeah. Correct.
Yeah.
Bhavani, can I say one thing?
Sure.
As Rekha pointed out, it's difficult to, differentiate who is Down syndrome and who is a normal community person like Gorkha, like Nevar's, Mami Nevar and Tamang, Limbus and all. So that's one question. And in Nepal, there are such areas where no one has any reach to anything. So if a child with Down syndrome is born in that area, they don't know whether it's Down syndrome or not.
Yeah.
Because no information goes there. And
Correct.
what should we do for that area? That's my main concern. And Rima was also wanting to add upon something else. Rima, could you speak out, please?
Ma'am?
Yeah.
Yeah.
Yeah. I have gone through the article that you have shared, the reviews, what should be given, who should use and everything. I went through the article. It was basically done in United States.
Yes.
So I went through each and every, and it was very good article. Like I read it, and then what I found is it was in the context of United States, and as per my, I have studied in India for more than 7 years. I have been with the community as well. I was there in India. I am from Nepal, and in that community, keeping in that cultural and socio-economic aspects, what I found is in the subsequent follow-up appointments and in the other follow-up visit with the doctors, along with the parents, the grandparents should accompany it too. Because I have seen many parents who have a child with Down syndrome. Recently, a week back only, a parent came to me, and after the physiotherapy session, I'm a physiotherapist. After the physiotherapy session, what the mother was crying, telling that I'm staying in my own home, not in my husband's home, because my in-laws won't understand everything. So it's equally important. Even it's the in the first visit, it's the parents to whom we break the news. In the subsequent visit, in the countries like in Nepal and India, I believe that it's strongly important to give a chance for the grandparents, the in-laws, and the other family members, because
Rima, in India, we never do a parent counseling. We do family counseling.
Yeah,
Because
that's
the extended family has to come in.
Yeah, that is very important.
Yes, because you know that we are very closely connected in India and Nepal too. So we have set that as a practice. You can't come without the support group.
Yes, so I think India and in Nepal, mostly I don't know much about the other countries. In Nepal and India, it's very important that the family will come for the counseling for the first need. So that's how it is.
I mean, I'm definitely the reason why I circulated that is there are only 2 good articles. I haven't sent you the other one. The other one is from Science Direct, which I will do. But both these articles kind of capture in the nutshell what are the things in broad categories that you need to consider when you do counseling. So I think, as you rightly said, it is from the Western countries. And so it is sad that there's lack of information from the Southeast Asian countries, but that's what we're trying to break now. So I think if you just read literature, there's not very much where there's a talk about how to break the news in Southeast Asian countries. I think we all do it individually. We're not able to pull it out from a literature bank in that sense.
No literature. We are practicing it in our Delhi settings also, but the literature is lacking.
Correct. But that's what we're trying to address also now, I think.
Thank you.
Yeah. So I think if we can just even stick to this one project, that would be great. I can't think of doing very many, but just as a reminder again, I think we discussed last year, June, about setting up your own registry if you have your own organizations. And I keep emphasizing that because when this organization goes to a stage when you want to do research on a larger basis, the only way you can actually quickly identify families and start doing any kind of research will be, unless you don't have the pool, you're not going to be able to do the research. I mean, I'm not telling you to actually start doing any research without consent and stuff, but all I'm saying is have the pool with you. People who come to register, create your own simple database. It's not easy to create very large databases without support, but have a simple framework that you can identify the families. And I think it's very, very important. I think I brought this up last time, and I think it's very important that each of you keep within your own. So when they come for your first visit and you register them, that becomes your database. And then later, when you want to do studies, you want to do surveys, everything, it becomes so easy to just pick them up. So I think I have not very many other things to say, and I'm very happy for each of the team to actually go through if there's any questions to ask. And then from my part, the sample survey questions, I will send that. I think that's my part. But anything that you want to discuss or bring up, Lalita, with regards to your question regarding how do we identify people in rural areas who don't have a definite diagnosis and facial contour and may be difficult for you to make a diagnosis, right? It is challenging, I think. I don't think it's easy. The only thing is, I mean, if you have like, I don't know if you have like health booklets which look at milestones. Is that part of Nepal's, like 1 to 5? Do you have developmental milestones for every child who goes to PHCs?
Yes.
You do, right? So if you find that they are showing delays in domains, then that's something that you can actually start picking up, because they become a part of some developmental delay. And then the next step will be at least to say, whether be it Down syndrome or other, anybody with a developmental delay that is significant in all domains should have a karyotype anyway. So that's a domain you can kind of look at. At least you can start suggesting, and you see whether the resources are available to get a karyotype done. Because I think it's also unfair just going on physical features and saying I'm suspecting Down syndrome, because I think that's not very nice for the family to kind of, you're just making a wild guess, and I think that's not very nice.
Bhavani, can I interrupt you? Like, I was talking about the pockets where there is no access to nothing, like no person who can tell them anything, like any information cannot be dispersed to them. What can I do for them?
I mean, if you have like healthcare assistants that you contact, then you could just send ask them that if the child is showing delay in all the domains, I don't know how you'll contact them. That's the point. I don't know. Is it like...
Yeah, it's difficult for us to decide whom to talk to. Like there are pockets where nothing is there, like we cannot reach them, even they don't have a cell phone with them. So that's the most difficult part where I'm thinking what to do. After 17 years, 20 years, out of the blue, someone calls, Mera bacha yesto tha, then what to do?
Yeah.
It's very difficult.
It's not easy.
And you miss out the Down syndrome, people with Down syndrome or a child with Down syndrome. We miss out those numbers also.
Yeah. not an easy task unless you actually take a van and travel to those areas.
Yeah. But Lalita, that's what we did initially, because in India too, in some of the rural areas, there was no concept. Let's talk about 20 years ago. So we have spread it through, families who have, been ready to move into those areas. It doesn't have to be you. There has to be a group. And if you look at your young physical therapists, they can start moving in. I'm being serious. The team works.
Yes,
Send in the team to check with the hospitals, because what we have done is we have worked closely with hospitals or with the district hospitals, with the government hospitals. That's how we tied up with the rural areas, because only they will get an idea about some type of the child has got, some facial recognition, somebody would have talked about it. Otherwise, it's very difficult. Even for us, till about 3-4 years, there's no news, even today. And that takes time, because we are still where we are, takes time for everybody to know that this child, because it has not spread that much. But it'll take time, it'll happen, because you are working very hard. And now I think people are more aware. So even the doctors have to be aware. That's what I think.
Yes, that's the part. You rightly said it, because even in Thapatali, the biggest maternity hospital, doctors say, Timro bacha yesto cha, like your child is like this, and he may not do anything. Tapai jano somewhere, like we people go to Disha, Nepal or wherever, they won't speak properly to them. Yes, I mean, people, gynecologists, I'm being a gynecologist, I'm criticizing, but this is the truth.
So I think, Lalita, once is good at some point in time when you have the time, is to look at all your touch points. Like if there is a disaster in that place, I'm not talking about Down syndrome or recognition. I'm just talking about if there is like an environmental disaster, who are your touch points? So I think it's good to actually identify touch points first, because the dissemination becomes very difficult unless you have somebody whom you can anchor to there.
True.
It's not practical for you people to keep traveling there, but if you identify touch points and start working with them slowly, like panchayat head, or I don't know who is they will definitely have some idea of the of the local issues there. Police, I don't know, like identify some touch points and see whether you can work with them. It's a long drawn process, but at least you've identified it. I'm sure you'll find a solution.
Yeah, but do you have an academy of pediatrics, Lalita?
Yes, we do have. And I'm educating them also.
Yep.
They are not aware of what is happening.
That is what, make them aware first, because we have to hammer their doors.
Yeah.
Because they are the first initial people. So if we don't inform them how it can happen, they don't know. So I think it is about collective work, and therapists plus pediatricians have to be called together, make them aware. I think that will be in regional areas. Okay.
Trying my best, Rekha.
Yeah, you call us, we're ready to come.
Sure. Thank you so much.
I just want to remind everyone, we have about 5 minutes left. This is a line which I think you've heard me use every time you see me, whether it's here or Kuala Lumpur or whatever. So 5 minutes left. Also to say as well, we have some new people in the group here who are not necessarily on the WhatsApp group. So if you're not on the WhatsApp group, but you're in attendance today, or there's other people that you wish to be added to that, then please email Brenda at the info@APDSF address. And then she can add your telephone number onto that. We want as many people as possible to generate the most healthy discussions as well. And I've also put a message out on this group today to say that have a think about what you'd like to discuss at the next DSMIG meeting as well. We might not be able to discuss absolutely everything, but we prefer to have more to discuss and then cut it down than have nothing at all, which I doubt that's ever going to happen, to be honest. So, but yeah, so please have a good think. And if you ever have a brainstorm of any sort and you want to drop it on APDSF and discuss it, we can always have interim discussions in the meantime. I believe Philippines recently came up with some statistics which we bounced around between each other, and we were sort of discussing the validity of it, and we came up with some good discussion on there as well. So so that's it. We have 4 minutes left. Dr. Bhavani.
Yeah. So thanks again once for all of you for being here. But I think the agenda is clear. We are going to do postnatal counseling. And I think the first start will be send you the sample questions. So there are two components. One is sample questions for survey, and two is what are the components you actually want in the postnatal counseling? You know, at what interim periods? When do you want? One is informing diagnosis. Two is you're going to talk about medical issues. You're going to talk about psychosocial issues, educational issues. All these come somewhere along the line in postnatal counseling. But each one of us do it in slightly different manner, right? So these are my ways of approaching it. But I'd like each one of you to say, no, these we don't discuss at all. We discuss this, we don't discuss this. But I'd like you to pen down what are the things that you all discuss at varying time intervals, because they are all considered postnatal counseling.
Right.
And if you give me the sample survey will come out from me, but the components of the counseling, I want each one of you to just throw in some ideas.
Perfect. Done.
Great.
Great.
Wonderful. Nice to meet you all. And if there's anything, like Paul said, please don't hesitate to put it in the group, and very happy to have some discussions.
Thank you all so much.
Last of all,
Lovely faces.
can I speak? Last of all, I would be giving a good news that tomorrow we are having a workshop to get the multidisciplinary clinic.
Excellent. Thanks, thanks for reminding me, Larita. Yeah. So again, if there are things that you have moved in the medical circle, please put it up in the chat, in the group, because I think these are excellent things that are happening. It's great to see it happening.
And any further notes which could be added tomorrow? Just few, one or two, not much.
Sure.
From you.
Sure.
And Rekha also, please.
Yes,
give me
we're
some
always
hints.
ready.
I think we've come to the conclusion of the meeting. So it's been a very healthy turnout, lots of country representation, great information that's been shared. And if you have any afterthoughts, please pop it on email or on the APDSF WhatsApp groups. And that's it. And just remember, APDSF wouldn't be APDSF without all you guys and all your great information that you give us, all the discussions you give us, and your enthusiasm and energy. So from my personal half here, I'd like to say thank you, and on behalf of APDSF as well. So apart from that, have an amazing weekend, and we look forward to catch up on you soon in whichever medium.
Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you, everyone. I'm
Bye-bye.
ending the
Thank you.
meeting now.
Thank you.